Good afternoon. The past few weeks have been a challenging time for Montanans. From what we know of recent cases, cluster investigations, and the follow-up contact tracing work, contacts and household contacts made up nearly half of all cases reported in May through July. In July, clusters have added more than 1/3 of the cases in this month. The percent of community-acquired cases has increased in June and July, and 9 counties now report community spread. This is especially concerning in Yellowstone and Gallatin counties. In the past week, Yellowstone and Gallatin have accounted for 60% of the state's new cases and 50% over the last month. Both counties have clusters of cases as well as community transmission occurring, and both have many cases under investigation. In Gallatin County, clusters and community transmission are contributing to the increase in cases. While many cases are still under investigation, work sites are a factor. And as Montanans, we've been particularly hard hit by the situation that unfolded at Canyon Creek Memory Care. This is a heartbreaking reminder of the devastation COVID-19 can inflict upon vulnerable Montanans. In Yellowstone County, this facility has contributed approximately 90 cases. In addition to that event, many cases appear related to small clusters or groups, with many others still under investigation. Community spread is a factor in many of those cases. 16 Yellowstone County residents are hospitalized in Billings, almost 45% of all active hospitalizations. At this time, the gradual increase we're seeing in hospitalizations, it's certainly concerning, and transfers from other counties result in heavier loads on some of our regional medical centers. However, we're still in a safe position when it comes to ICU beds and ventilators. In the last month, active cases in Montana have risen from 55 to over 1,000. While we're still the lowest per capita positives and hospitalizations in the continental United States, when it comes to total cases in Montana, we've doubled the number of cases just since the start of July. Inability to control the spread of COVID-19 endangers vulnerable Montanans. It endangers businesses who want to keep their doors open, and hospitals who need the capacity to treat both COVID-19 patients and all others needing medical care. Too many continue to congregate in large gatherings, where a single person can spread COVID-19 to many others. And too few are wearing face coverings in public settings where social distancing isn't possible. Now, many Montanans have answered the call to mask up, a call that came from our hospitals, our nurses, our doctors, our vibrant small business community, State Chamber of Commerce, many local chambers of commerce, our frontline workers, and our high-risk neighbors. I thank all of those who have taken seriously their personal responsibility and their role in stopping the spread of COVID-19. Though these efforts may go unnoticed in the number of cases that never occurred as a result of Montanans' vigilance, they are certainly noticed through the act of being a good neighbor and caring about the health of other Montanans. But we need even more Montanans and those visitors who come here to mask up. Use of a cloth covering over the mouth and nose is an effective way of limiting the potential for transmission to others by both symptomatic and asymptomatic individuals that are infected with the virus. Recent research suggests that universal use of face coverings in enclosed public spaces would substantially reduce the spread of COVID-19. It was certainly my hope that everyone across our state and the visitors recreating here would listen to the science and follow the lead of our most committed Montanans. Our neighbors, parents, and grandparents have called on others to be personally responsible by wearing a mask. So too have local businesses and Grizz and Cat fans, as well as health experts at the national, state, and local levels. Unfortunately, it's become clear that we need to do more, and that asking folks to do the right thing just isn't always going to be enough. My first duty is certainly to ensure the health and well-being of all Montanans. Epidemics of dangerous diseases have long been a threat to America throughout our country's long history. As a result, even since the earliest days of this nation, the United States Supreme Court and the Montana Supreme Court clearly have recognized the state's authority and duty to fight outbreaks of disease and impose quarantines, mandatory vaccination orders, and other public health measures to prevent the spread of contagion. Now, compared to some of those past measures, the use of face coverings is a modest imposition, but that can do a great deal to keep Montanans safe and also to keep Montana businesses and our main streets open. It's why effectively, immediately, in counties with 4 or more active cases, be issuing a directive that requires face coverings in certain indoor business settings to prevent the spread of COVID-19. Face coverings will also be required in outdoor gatherings of 50 or more, but only if social distancing isn't possible or isn't being observed. The requirements will only apply in counties with 4 or more active cases. The counties that have more than 4 active cases can be found on the active case map on the covid19.mt.gov website, and thus fall under the mask requirement at this time. Now, for those counties that do not currently fall under a mask requirement, it's still strongly encouraged for businesses, for individuals, for all Montanans to mask up. The covid19.mt.gov website will be updated daily with new counties should they fall under or be removed from the mandatory mask requirement. I want to explain how this requirement works, which is based on the actions of other states, conservative states even like Texas and Louisiana. First, all businesses, government offices, or others responsible for indoor spaces that are open to the public shall require that all employees, contractors, volunteers, customers, or other members of the public wear a face mask that covers their mouth and nose at all times while entering or remaining in any indoor spaces open to the public. Face coverings will be provided for all employees and volunteers. All points of entry open to the public shall have a clearly visible sign posted stating that mask or face covering use required for ages 5 and older. Children under age 5 certainly do not have to wear a mask, but children between ages 2 and 4 are encouraged to do so per CDC guidelines. Children under the age of 2 should not wear a face covering. Now, other exceptions where masks are not required include consuming food or drinks in an establishment that offers food or drinks for sale, engaging in an activity that makes wearing a face covering impracticable, or unsafe, such as strenuous physical exercise or swimming as examples. An exception when you're seeking to communicate with someone who's hearing impaired, like our interpreter Vicky here is doing today. Exception if you're giving a speech or engaging in artistic, cultural, musical, or theatrical performances for an audience, provided that that audience is separated by at least 6 feet of distance. Exception for temporarily removing your face covering for identification purposes. Or if you're required to remove face coverings for the purposes of receiving medical evaluation, diagnosis, or treatment. Or for those who have a medical condition precluding the safe wearing of a face covering. Face coverings certainly don't need to be worn in private residences that are not open to the public, though we still encourage social distancing and limiting your gatherings for the safety of yourself and for others. Second, there's a mask requirement for large outdoor gatherings of 50 people or more, but only where social distancing isn't possible or isn't being observed. Nonprofits, businesses, governmental offices, and others who operate public spaces will remind folks of the mask mandate, certainly can call local public health and law enforcement for assistance in enforcing this order when necessary. I want to be clear, though, that I expect that the role of public health and law enforcement authorities will in almost all cases be about education, reminding people about the requirement and the importance of keeping our community and our community members safe, and saving formal enforcement like fines or trespassing for only the most egregious repeat cases in which the public is put at risk. Businesses and other people responsible for indoor spaces certainly may deny entry, refuse service, and ask you to leave if you don't have a mask or aren't eligible for an accommodation. No shirt, no shoes, no mask, no service. It's that simple. Now, the full directive will be emailed out, can also be found at covid19.mt.gov. I can't say enough about just how easy it is to wear a mask. You saw me take mine off before speaking today. And everyone in the room with me is wearing one unless they need to speak too. Just like how we put a seatbelt on when we get in the car and unbuckle it when we need to get out. And there's no reason that this needs to be political, because COVID-19 isn't political. It's encouraging to me that even in the last few days that we're seeing political leaders, including the president and the first lady, encouraging people to wear masks, trying to depoliticize it. Coronavirus doesn't care if you're a Republican, a Democrat, or an independent. It doesn't care about theories or speculations or projections. It's an unthinking parasite that can affect you either way, and it relies on you to spread it to others. So this is about being a Montanan and being supportive of those around us. Montanans need to not only feel safe, but to be safe, to continue supporting small businesses like restaurants and breweries, clothing stores, bookshops, and more. And Montanans need to be healthy to work. Mom and pop shops in Montana often have only 2 employees, mom and pop themselves. If they get COVID-19, they can't keep their businesses running. In so many respects, over the last 4.5 months, together we have done so well. A stay-at-home order was taken seriously by Montanans. That kept our numbers down. Social distancing has been taken seriously by Montanans. That helped keep our numbers down. I'm asking you to take this seriously as well. It's incumbent upon each and every one of us to protect our communities, to limit the spread of this virus. Look, no state's out of the woods by any measure, nor is Montana. I hope 2-3 weeks from now, we'll be having a conversation knowing the difference that's been made because employers and businesses and everyday Montanans said, we can do more to keep the most vulnerable among us safe, and we can do more to limit the spread of COVID-19. Now, visitors to our state will be required to follow the same directive. As Montanans, we'll send a message that to recreate here, you must be mindful of that same spirit of promoting kindness and respect toward others that us Montanans know all too well. I also want to remind and encourage businesses to make use of our business adaptability grants, which provide reimbursement for COVID-19 expenses through coronavirus relief funds. If you need to purchase masks for your employees, hand sanitizer, other things, this program is available to any business that needs it at covidrelief.mt.gov. Certainly, there's already been a lot of chapters of this that we've all both written and lived through together, but today does begin yet another new chapter in our continued efforts together to mitigate the spread of this virus. I know that over the past 4 months that Montanans have faced unprecedented difficulties, but we can't let that allow us to let our guard down after how far that we've come. We're going to team up, we're going to mask up, and we are going to slow the spread of COVID-19. Masking up now is especially important, not only because of numbers we see, but also, as I've seen this, we face some recent challenges to our testing capacity. On Monday, I learned or was told that Quest Diagnostics will not be able to perform our sentinel surveillance testing for at least 2 to 3 weeks until they can improve their capacity. Over the past couple of weeks, and as case numbers have substantially spiked across the country, Quest, which is the reference laboratory out of Montana where we've been sending the surveillance samples, it has delayed further and further its turnaround time, not just in Montana, but indeed across the nation. When it takes a week to 10 days or more to provide us results back on our tests, it really is of more limited value to Montanans. Look, and I'm deeply concerned with the lack of what I think is national testing strategy from the federal government. Their strategy up to this point, or at least for this chapter, was that we utilize private labs in order to reach those testing targets. And after many conversations with senior officials in the federal government, it was about 2 months ago that we were finally able to set up with Quest to conduct our community surveillance testing events with an assurance of a 72-hour turnaround time. Just like the challenges that we faced 4.5 months ago when the outbreak first occurred, it's still clear that the federal government's ill-prepared to find the solutions as cases increase across the nation and private labs are becoming overwhelmed. The reality is that here in Montana, we've done everything possible in standing up further testing capacity. And we've made significant progress. In fact, a Harvard Institute study, I think it was last week, recently named Montana as one of 4 states performing enough testing to control the virus. From mid-June to mid-July, where we are now, we performed over 55,000 tests in Montana. Importantly, we prioritized testing for symptomatic individuals, for asymptomatic individuals found through contact tracing, for our tribal communities, and for those most vulnerable in our nursing homes. Montana has come close to or surpassed our testing target of 15,000 tests a week in recent weeks because of our diligent efforts. State labs added additional equipment to perform over twice as many tests each day and continues to have a turnaround between 24 and 72 hours. Working with federal partners, as well as even manufacturing some of our own, we were able to secure sufficient and steady supply of nasal swabs and transport media. Now we're at another roadblock, and it's uncertain over the next few weeks whether we'll be able to stand up all of the mass community snapshot testing events that we've encouraged and planned for. As I've said all along the way in response to this pandemic, I'm not going to let shortcomings or obstacles or shortcomings at times of the federal government prevent us from doing what's right for Montanans. Me and our administration are looking at every avenue possible to further enhance our testing capabilities at the state lab, here in Montana or elsewhere. We're currently pursuing a couple of potential options, both in-state and with another contract that would allow us to fulfill our testing needs out of state. But as this is Wednesday and this all came Monday, we still have more work to do, but we'll keep you updated. One final update before we turn it over for questions. Our schools must have every opportunity available to ensure that they can adequately prepare for the upcoming school year and reopen their doors to their students with full precautions and in a safe manner. Using Coronavirus Relief Fund dollars, we'll be providing funding to schools for pandemic-related expenses for school reopening for the first half of the school year. Now, approximately $75 million will be distributed to Montana's K-12 schools based off of the fiscal year 2021 budgeted A and B, or average number of belonging, of each school district. An additional amount based on per student funding will also be made to private schools. Schools will be provided an evolving list of eligible expenses ranging from transportation costs to hiring additional staff to additional supplies. I know that there's some discussion at the federal level about providing funding for our schools so that they can safely reopen. But frankly, our local schools, our school leaders, and our school boards are making the decisions right now about what's needed and can't wait to see what Washington may or may not do. In addition to that funding, the Department of Disaster and Emergency Services will be making a bulk purchase of PPE supplies that will be distributed to schools. It includes everything from masks, gloves, hand sanitizers, cleaning supplies, and no-touch thermometers. As we finalize the distribution process for schools, we'll keep you apprised. We know that our schools, along with our teachers, administrators, and parents, are tackling so much in preparation of hoping that our students can return to some normalcy, or at least new normalcy, this fall. Things will certainly look a lot different in the hallways and classrooms. But health and safety has to remain that top priority. And while we're way off in determining what things will look like in the fall, it's in the best interests of everyone that we start prepping now. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. If your question has already been answered, if you press 5* again, you'll get out of the queue. First phone question.
Hi, Governor Troy Shockley from the Montana Radio Company. You mentioned it, but in terms of enforcement of the mask up, I mean, where does the onus lie? I guess I wonder how this will be done, and then maybe the obvious follow-up is what are potential penalties for this? If it doesn't have any teeth, I guess how do you expect people to be forced to follow it?
Well, sure, Troy. First of all, the enforcement, the obligation falls on all of us, right? When we had a statewide stay-at-home directive, it's not like you had people going home to count how many people are there. So first and foremost, it really is on Montanans to take it seriously. Now, the directive is written to be enforceable against businesses. Businesses have the ability to deny entry, refuse service, ask any person to leave. Certainly, if they refuse to leave, a peace officer could enforce the state's trespassing laws. But I think that most Montanans take this seriously and will do what it takes to keep one another safe. I also think Montanans are real concerned about the increase that we're seeing over the last few weeks and are keenly aware of how quickly that this virus can spread and have devastating results in our communities. So wearing a mask is one of the ways that we can minimize the risk. And I think most folks will comply. And to the extent that there's violations, that law enforcement and public health will be educating more than taking actions. Next phone question.
Yes, Governor. This is Casey Elliott at Dillon Tribune in Dillon, Montana. I have heard or have seen here that the Centers for Disease Control and Prevention is not going to be taking test data anymore. Can you comment on that?
Doc, do you want to do that? Yeah. So there was something that recently came out, and Doc Holzman might add. It's not that the CDC won't be collecting data anymore, that the Federal Coronavirus Task Force in the White House asked that hospitals and others send that data directly to them. Look, it's the Center for Disease Control that actually accumulates and aggregates the data along the way, and that we've long worked with, and our expectations will still be getting information, both providing information to and getting information from the CDC. Do you have anything else to add? Next phone question.
Hi, Governor. This is Jonathan Hedinger from Montana Free Press. I was wondering what it means that Quest can't perform sentinel testing for 2 to 3 weeks. Does that mean they can't process any tests? And what does that mean for the thousands of the surveillance tests that are currently pending? And then I was just wondering if counties are also still encouraged to do this surveillance testing.
Sure. So what it means for both the tests that are pending right now, like tests that have already been taken and are at Quest labs right now, or for some of the surveillance tests in our Indian nations that we have scheduled as of today, Quest will still take those tests. But the problem has been twofold, one of which is there's spikes all across the country. The timing has it's taken longer and longer for us to get those tests back, much longer than what our understanding was 2 months ago. And what they had informed us recently is in 2 days ago, is at least for the next few weeks, once we get through both what's that scheduled and those that they have pending already in their lab, that we can't be sending them additional tests for processing. So that's where, we're doing the work right now to say, what's yet another workaround to ensure that we can continue surveillance testing. But that may take a little bit of time, and there are some community events going into, like next week as an example, that may well have to be canceled. Next phone question.
Governor, this is Tristan Scott from the Flathead Beacon. I've got 2 questions. How did you arrive at the figure of 4 active cases per county, and if a county drops below that threshold, does the ordinance get lifted? And I'm also just curious if this is going to create if the inability to process tests is going to create a backlog of unprocessed tests and further exacerbate this cycle.
So first, like, how did you come at the 4? And if indeed you turn around and have, like, if you have 6 active cases and a week goes by and it's only 2, do you drop off? What does all of that do? First and foremost, the encouragement is for everyone to wear a mask, no matter what county you're in, no matter the status of the county. But in coming up with a number of active cases and recognizing that, 4 cases might not be a lot in Flathead County. But in a county where you only have literally like 1 ventilator at the hospital, or much less healthcare facilities, that it could challenge it. So I looked at what other states had done. Some of them have county or regional directives based on what the virus was, but also wanted to provide some degree of clarity so that folks could, I mentioned earlier, we know of 9 counties at least that have community spread. Knowing what's happening on the ground and clarity for the businesses and the individuals, thought putting a hard number on that would actually provide the assistance for all Montanans to know where to go to see what the status of their county is. And the second question, would the delay in the delays caused by Quest further exacerbate the problems that we're having with the increased numbers in our state? Now, to be clear, by and large, most of the tests that have been leaving Montana to go to reference labs are through the larger surveillance testing. And by and large, the vast majority of positives have come through symptomatic individuals or through the contact tracing, individuals that we have a much higher likelihood and reason to believe that they could be positive. That won't change. And the state health lab will continue processing, as they have, those cases with symptomatic, hospitalized patients, known contacts to a positive case. So it shouldn't change things that much in some respects, but we want to get that widespread community sort of snapshot testing out there, both to detect asymptomatics and mitigate community spread. So that's what we'll be working on replacing.
Governor Jeremy Schnell from Montana right now. How close were you, or where do we need to get to for that number of 50 or more people gathering to go back down to 10, and as well as bars and restaurants being just takeout again?
Well, a couple of different things, and one of which is like Whitefish, as an example, just did an ordinance, masking ordinance, where it said outside, I think, 20 individuals. And still would encourage local jurisdictions, counties in our tribal nations to take those steps and be more restrictive than if they choose for the statewide directive. And you're seeing across the country, I mean, not just in California, but in places like Texas and Florida, in Arizona, going back to a phase 1, closing down the restaurants and their non-essential businesses. I don't want to do that. Montanans don't want that to occur. That's the principal reason that we're taking these steps today. Because just like the actions that all Montanans took got us to the point where we're the lowest per capita in the nation, it's the actions that Montanans will take in respecting the most vulnerable and their friends and neighbors that will keep us from having to take steps back like so many states have done. So like we have all throughout, certainly, we'll look at hospital capacity. We'll look at ensuring we still have enough PPE. We'll look at what the virus is doing along the way all throughout our state. But this is the one where we all have a role in ensuring that we don't take steps back, and highly encourage Montanans to take that seriously, because we know that, and certainly wearing a mask is different, can be a seeming imposition, but we also know that that's one of the most effective things we can do short of closing everything down to limit the further transmission of COVID-19.
Governor Bullock, Maritza Georgia with NBC Montana. I've asked you publicly about a mask mandate several times. I'm wondering why now? What was the final straw for this decision? And I have a second question when you're done.
Sure. Yeah, a couple different things. I mean, we've been working over the last few weeks to get greater community acceptance of masks, right? When you have the state's largest business organization encouraging it, when you have football coaches for the Grizzlies and the Bobcats encouraging it, when you have local chambers of commerce, we want to get to that point where Montanans are doing right, not because of a mandate or a directive, but because we know it's the right thing to do. And certainly, I think steps, we've seen steps being taken around the state where people have taken it seriously, but it isn't enough. And the increasing case numbers demonstrate that we don't want to take steps back. And we also thought that, look, in order for a mask requirement to be effective, I mean, I said to some of the public health folks 2 weeks ago, maybe we should just do this. But also, for it to be effective at the end of the day, it needs to become socially acceptable. And I think more and more we're seeing, not just in this room, but as you go out in our communities, it is becoming more and more socially acceptable. But our numbers are climbing, and they're continuing to climb. And we've got to change that. And masks and the rest of and let's not kid ourselves, the things that we've been hearing about for months of social distancing and not aggregating in groups of folks that you don't know and spend a lot of time, more than 15 minutes closer than 6 feet apart, and hand sanitizing. Those are things we've been talking about for the last 4 months. And those are things we still need to continue to do to limit the transmission.
My second question is, in addition to the testing lag time issues and results coming back, I'm hearing about a possible shortage of reagent. Have you heard anything about that?
So one and the same in some respects, right? So let me further sort of unpack that suitcase, right? You have the testing supply, which is like the transport medium and the nasal swabs. Those get shipped off to a machine that then processes those tests. And within that, as an example, then, it's the reagents that run the tests to figure out if you're positive or negative. So it's the reagents, it's not just capacity at Quest, it'd also be the reagents that they have. At the state lab, we're not having challenges with reagents. But one of the enduring frustrations is we look at how do we amp up capacity. For some of these machines, there's a machine in Bozeman, a machine in Missoula, a machine in Billings, where we could actually then take and run mass tests through those if we had the reagents. So even a call on, today's Wednesday, Monday, with Admiral Giroir, the head of sort of testing and testing supplies. That's one of the things he said, get me the reagents for it's the Hologic Panther, it's one of the machines. And then I won't have this problem with Quest. But it's not just a problem in Montana, it is a problem around the nation. My point when, look, 130, 40 positive cases in a day is alarming. It's not 14,000. And to keep our testing capacity up doesn't take what most states would need. But by the same token, when there's such demand and such greater hotspot, that's where getting those reagents through the private market for some machines, there's a scarcity of supply. Now, you'd hope that 4.5 months into this whole thing, that we would have figured it out. And I recognize in some respects, like there are in some areas, I think that as an example that they have implemented the DPA, the Defense Production Act, but you still run into scarcity. So that's been the problem with reagents. Yes, sir.
Governor Bullock, John Riley, MTN News. I've got 3 questions. If
Three?
I know.
All right.
The first one is, will this mask ordinance apply to schools this fall if they are holding classes in session?
So as of now, no. And I say as of now, no, because I think school districts and schools are making plans right now. What this applies to as of effective immediately is to government offices and political subdivisions and businesses. But I think there's a lot of that discussion among schools. One of the reasons, in addition to being for reasons of safety, had said, let's turn around and have the masking ordinance or directive at ages 5 and up. Now, like CDC says, anybody above 2. Some states and counties have done age 12, but at age 5 then, even our kiddos who would be in a kindergarten will become accustomed to wearing these long before the school districts start.
My next question is, you mentioned testing and protecting those vulnerable populations. Has there been any consideration to mandating testing at our care facilities?
Well, the answer is yes. Now, by and large, when you look at the long-term care facilities, just about every one of them agreed to do it. That wasn't necessarily the case with all, but the vast majority of assisted living facilities. And, Canyon Creek is an example. It didn't take up our surveillance testing. But it also then, when we lifted the directive that said you could have visitors, they hadn't allowed visitors. So that's not what happened along the way, right? I think it's still under investigation, but employees or others. For 4 months, we had a no visitation policy, roughly 4 months for all of our long-term care facilities. 2 weeks ago, I changed it so that if they want to have visitors, they have to engage in a testing protocol and program, and that's on a weekly program. I think most will certainly respond to that because also the social isolation of our legacy Montanans has been significant over the last 4 months.
And then my final question, because I'd be remiss not to ask it, is opponents of masks say that it is their constitutional right to get sick, much like they can oppose to be vaccinated. Do you have a response to that?
Well, 2 things, at least. One of which is you've got 200 years where certainly the courts have said for public health mandates and requirements that they're enforceable public health. And you go back to 1918 where literally there were being things put on people's houses whether they were quarantining or not. That's why I think a mask is a pretty small step. And an individual might think that they have a constitutional right to get sick if they so choose, but they don't have a constitutional right to get other people sick. And more than that, our liberties are so important, but every liberty can be constrained at times for the greater good. I mean, I was thinking this morning on my run, the most absurd thing would be saying, well, homicide laws are an infringement upon my Second Amendment rights. No, what we're doing is we're living as part of a society and a community to take care of one another. So more than infringements, let's hope that we all turn around and say, as folks like Senator McConnell now has said, or even the president has said, right? Let's say we need to do more to take care of one another, because we've dealt with this virus for a long time, and we don't want to be dealing with it to the point where we're shutting down things further. Phone question.
Hey, this is Holly. Can you hear me?
Hi, Holly.
Hey, how are you doing, Governor?
I'm okay.
Good. I've got a couple questions for you as well.
Okay, go ahead. Why don't you ask one, then we'll answer it, then get to the next one.
Okay, perfect. So the first one, and I think you touched on this a little bit, so sorry if I'm duplicating, but hey, I'm wondering if you know how many tests the state lab is capable of running a day and what the turnaround time is there, and then looping in some of the other in-state options that we have. If we're at maximum daily capacity within the state right now, I'm sort of wondering if you take away some of the surveillance and sentinel testing, if we have more symptomatic people in Montana who need tested daily, if we have the ability to ramp up there, or if we're already doing the maximum.
Why don't I allow Jim Murphy to answer that question?
Yeah, Holly, I think it's a good question. I think since the beginning of this event, we've seen the capacity at the state laboratory to grow dramatically. When we originally started out, our capacity was between 250 to 300 a day. Currently, I think our lab is doing about 1,200 to 1,300 a day, which has been because of increased processing, better equipment, better flow of a lot of the way specimens come in and are processed. So they've made dramatic improvements. We're probably close to maxing out those improvements, but new equipment comes along. Adding additional staff is also a possibility from time to time. However, space becomes a constraint too. I think we've seen a ton of improvements, and I do feel that we are confident that we have the ability in-house to handle the needs of symptomatic people and contacts who are recommended to be tested these days. So I think we're doing all right on that. It's the larger mass screening events right now that we need help, and as the governor indicated, there's partners in state and partners out of state that we're lining up to help with that. And we do hope that Quest, our partner in this, will be back online after they enhance their capacity in a few weeks, and we'll be back able to do the numbers that we were doing before.
And what's the turnaround time for tests that the state lab operate, or that they process?
24 to 72. Go ahead, Jim.
So currently, the state laboratory, which typically had enjoyed a 1 to 2 day turnaround time, is now telling folks that they can get a 1 to 3 day turnaround time. This is still dramatically quick turnaround compared to a lot of the laboratories that we deal with. We're seeing reference laboratories now reporting turnaround times 8 to 10 days, for instance. So our state lab is very proud of their turnaround time and working diligently to keep it that way.
And then this might be better for you too, Jim, but I wasn't clear. Are we able to pool or batch tests anywhere within Montana right now? Are we limited by the reagents, or is that happening anywhere in the state?
The question about pooling or batching tests is something that we're looking at, and for those that maybe aren't familiar with this, it's taking maybe 5 specimens from folks, mixing them together in one tube. That allows you to process more tests using fewer reagents, and then if that tube tests positive, you go back and you test the individuals. That is something that is being looked at. We haven't stepped into that yet, but it is something that is being considered.
And then last question for Governor Bullock.
Oh, come on, now you're like 6, Holly. Go ahead.
This is last.
It's not even your birthday today.
Talked about lack of frustration with a nationwide testing approach, and you talked before through this whole pandemic about frustrations with leadership from the federal level. And at this point, and seeing how much of the action nationwide has been taken by governors or even counties or just really at that local level. Do you have hope that anything will improve from the federal level? And if not, I mean, how does that change your plans for managing the state through this? I mean, at some point, do you adapt to just sort of think, okay, we're on our own, this is how it's going to look? Or
I mean, look, there are, I'd say almost every week over the last 15, 16, that I and other governors have had to adapt to changing situations and do our best with what we're given. And that's not by any measure or means to suggest that, you know, there's been some incredible partners at the federal level. Like, think about, I can't even remember the date where, well, all of a sudden swabs were dang near unavailable. Yeah, now we are manufacturing some of our own swabs if we need it, but swabs are available. We'll continue to both work with and encourage our federal partners along the way. As individual governors at times, we'll work individually and collectively, but it's also one of these that, be it 4 months ago or today, like, pointing fingers isn't going to keep anybody safe. It's not going to keep anybody out of the hospital. So we'll continue to work constructively, and we all collectively have to take the steps to keep Montanans in our country safe through this. And John, one back to John Riley, is the Lieutenant Governor also said that when we put out the schools directive last week or the week before actually, one of the things that it says in there is masks are highly encouraged. There's nothing in this directive per se that says it's mandatory, but we're still, you know, weeks, at least a month away from opening up schools. Phone question.
Hi, Governor. This is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding this press availability today. You might have said this, and I might have missed it, but that $75 million for PPE for schools, is that money coming out of CARES Act funds, or is that coming from the state budget? And if it's the state budget, where? And then I have another question that I'd like to ask after.
Sure, Nikki. So first of all, $75 million isn't necessarily for PPE. There will be additional money coming, and that's out of the CARES Act, where we're going to work to buy bulk PPE, and that's everything from masks and hand sanitizer and thermometers and things. We'll buy that through the Department of Disaster Emergency Services and then get it out to our individual schools and school districts. So that's in addition to the $75 million. And the approximately $75 million is coming from the CARES Act. Next question. Or you have another question? Did you cut her off? Okay, good.
I do have another question.
Sure.
We spent a lot of time talking about testing today, which is one of the major avenues for containing the virus, but another is contact tracing. And I'm wondering where and how the state is supporting county and tribal level contact tracing efforts, and if Montana National Guard members have been deployed to help with contact tracing.
Yes. What's it? Yeah. Directly for the National Guard, Nikki, that National Guard soldiers were deployed to the Crow Reservation to help out with contact tracing. Understand certainly local public health officials in Yellowstone County and Gallatin, which are two real hot spots, are making decisions about contact tracing efforts. They're still investigating certainly each case and the process for known contacts of any positive cases, quarantine still in effect. But as we see some of the potential challenges, we're also working to bring in volunteers such as nursing students and CNAs to assist local public health with contact tracing efforts if requested. And it's another one of these that, to the extent that a local public health needs assistance, certainly hope they'll be contacting us.
Yeah, I'm trying to keep up with Holly and John here. While so many leaders say masks should not be political, they certainly have become political. I'm wondering if you're concerned at all that this order will affect your bid for Senate.
Yeah, and so, and to step back to a degree that, like, every one of these I've kept out, every one of these is about coronavirus. It's not about running for office. I will say, just from a general perspective, that, look, I think all of us have learned a lot in the last 4.5 months. And I am pleased that I'm not the only one saying mask up. I mean, I know of at least our 2 senators, Senator Daines and Senator Tester, saying mask up. You've seen not only Speaker Pelosi, but Majority Leader McCarthy, or Minority Leader McCarthy, saying mask up. You've seen Mitch McConnell and Chuck Schumer say mask up. So I think, just like the evolution of, you could have said a long time ago when people were upset about doing a stay-at-home order, that I think that we are going to get beyond the politics of masking. When the First Lady of the United States tweets encouraging masking, when the President now is wearing it, we're recognizing that some things are a lot more important than politics, and that's public health. So we'll continue to encourage, and I'm so pleased that others from across the political spectrum are now encouraging it as well. Well, thank you all very much. Oh, shit, where did my mask go?